Welcome to Listen to Your Skin by Moon and Skin, the podcast where science meets nature to celebrate the story of your skin. Your skin is a living canvas, ever evolving, deeply personal, and uniquely yours. Each week, we'll dive into the science of healthy skin, share empowering stories, and uncover transformative self-care rituals. We're here to help you embrace every phase of your journey with confidence and care.
Hey everyone, welcome back to this week's episode of Listen to Your Skin by Moon and Skin. And I am your host, Dr. Jen Haley, a board-certified dermatologist. And I'm so grateful to be here today because I love answering your questions. So as the channel grows, we're getting so many great questions. And this is what I love. I eat this stuff up. So keep sending your questions because I want to serve you. And I'm so grateful to have been partnering with Moon and Skin. They're doing some great things and great educational content. So any part of it that I can be, I am happy to be here. Okay, so we're going to start with the questions. What are the best ingredients for treating acne-prone skin? So it's such a loaded world we live in where there's so many products out there. It's so overwhelming. And with marketing and names of products, there's so much false and misleading information. So I want you to start looking at your skincare like you look at your nutrition labels. Turn it around and look for certain ingredients. Okay, so when it comes to treating acne-prone skin, we want to know what type of acne we're dealing with. And this will determine what ingredients you want to look for. So the first ingredient that I universally love for most skin types is salicylic acid. Salicylic acid's been around a long time. Encapsulated salicylic acid's really nice because it tends to be less irritating. But salicylic acid, it's a beta hydroxy acid. Actually, scientifically, it's a polyhydroxy acid, but you'll see most labels call it a beta hydroxy acid. And the reason I love it for acne-prone skin is because it's drawn to oil glands. So unlike alpha hydroxy acids, this beta hydroxy acid, the salicylic acid, it's drawn to oil glands. So it will penetrate into your pores where the clogging happens and your pores get plugged up. And the other thing about salicylic acid is a keratolytic. So keratolytic being an acid that basically breaks apart and loosens up dead skin cells. So if you imagine it's drawn into oil and it's attracted to the pores in the oil gland, and basically what happens is it loosens up all of those clogged and plugged up oil glands, and then it exfoliates it off. And it helps your pores look smaller, it helps prevent acne from forming, and it removes all the dead skin cells that are plugging your pores. So it's really best for people who struggle with blackheads, whiteheads, and clogged pores. Not as good for inflammatory papules or pustules, the big red juicy ones. It's not going to hurt those areas, but it's not going to be the hero ingredient for those type of acne lesions. And while salicylic acid tends to be anti-inflammatory, overuse of it, which means you're using it too often or too high of a percentage, can certainly be irritating to the skin. So I recommend most people start with a 2% formulation, and you can use it in the form of a cleanser, a toner, or a serum. So either way, if you do want to use it in a cleanser, make sure you apply it to your whole face and massage it into the pores and let it sit for 2 full minutes, because otherwise it's not going to do anything if you don't let it have contact with your skin for a full 2 minutes. So salicylic acid being the first ingredient to look for if you have acne-prone skin. The second ingredient is going to be benzoyl peroxide. So benzoyl peroxide is effective at killing the acne-causing bacteria. And it works a little bit better for the inflammatory papules and pustules, the red juicy bumps that we get for acne. I also like it if someone is prone to shaving bumps, like men who get shaving bumps on their neck. It's a nice product to reduce the bad bacteria that cause the shaving bumps that can lead to significant scarring. The thing about benzoyl peroxide, though, is that it can bleach your towels and it can bleach your eyebrows and it can bleach your clothing and your hair. So just keep this in mind. And that's one of the reasons why I like it as a cleanser as well, because then it gets off your body and it doesn't soak into those areas like a serum or a gel might. So you could use it once a day or twice a day. So if you're someone who struggles with blackheads and whiteheads and juicy red pimples, you can use a salicylic acid cleanser once a day, a benzoyl peroxide cleanser once a day. Those would be really nice combinations. And the thing about benzoyl peroxide, though, is higher concentrations can be quite irritating to the skin and can cause a lot of dryness, redness, and irritation. So keep in mind that higher concentrations is not necessarily more effective, it's just more irritating. So look for a product that contains 2.5 to 5% benzoyl peroxide. You don't need 10% benzoyl peroxide. So that's the second ingredient. And the third ingredient I want you to look for, which is really essential, I think, for all skin types, especially if you're struggling with acne or discoloration of your skin or looking to reduce the rate at which you age or reverse some sun damage and fine lines and wrinkles, is retinoids. So retinoids it's a global term that we use for vitamin A derivatives. So these vitamin A derivatives, which come from nature, they can be in the form of over-the-counter Differin, which used to be a prescription called adapalene. It can be in a retinol, which you can find over-the-counter, or it can be in prescription strength tretinoin. And basically the precursors of these vitamin A derivatives turn into retinoic acid in the skin. And I usually have people start with a retinol because it tends to be the least irritating, and then you can graduate over time if you tolerate it. But retinoids are the most scientifically studied ingredients in pretty much all of skincare, and they work very effectively for acne. They help unclog pores, they help reduce inflammation, and they enhance cell turnover. They also even out skin tone, and they stimulate collagen at the cellular level. But this enhanced cell turnover, if you're using retinoids too much and too often and too high of a percentage, it can make your skin really inflamed and peeling and dry, and it's hard to tolerate. So less is preferred. Start low and go slow with retinoids. They work through nuclear cell receptors. So what does that mean? So basically with retinoids, they work through nuclear cell receptors, and that means that you don't need to have full coverage of an area in order to get benefits. You have to trust the science. You only need a small pea-sized amount, and you dot your forehead, each cheek, chin, and massage it in. Avoid the creases around your nose, avoid the creases around your eyes, and avoid the creases around your lips, because these areas, the retinoids will pool and they'll enhance cell turnover to the point where it's irritating. The nuclear cell receptors are going to be signaled from these retinoids and help enhance cell turnover, unclog pores, stimulate collagen, and lift off pigmentation more adequately than applying it everywhere. So the other thing about retinoids is that you don't want to use it at the same time as a benzoyl peroxide because they counteract each other and they're not effective if you're using both of them at the same time. All the more reason why I like benzoyl peroxide in the form of a cleanser. You apply it for 2 minutes, let it do its job, and then rinse it off. And then you can apply your retinoid at night, use your salicylic acid in the morning. The other thing I wanted to mention about retinoids is there's a form of retinol that tends to be a hero ingredient called liposomal retinol. And this liposomal retinol, it goes through the bilipid membrane of the skin without causing the peeling and the irritation to the epidermis like a lot of traditional, less elegant formulations of retinol cause the irritation. So look for a liposomal retinol if you can find one in your ingredient list. And the retinol that Moon and Skin is producing has this technology in it, which is why I love it so much. Okay, the fourth ingredient I want you to look for is niacinamide. Niacinamide, also known as vitamin B3, it helps regulate oil production, it improves the skin barrier, and it reduces inflammation. So morning and night, it's very good at reducing inflammation. And the nice thing about niacinamide is it's tolerated by pretty much all skin types, and it's great for sensitive and inflamed skin. The thing you should know about niacinamide is that it works with most ingredients typically, although you want to avoid using it with highly acidic products. So if you're applying an AHA, BHA serum, you're not going to want to apply your niacinamide at the time. But if you are cleansing with a salicylic acid cleanser, then you can apply your niacinamide afterwards. And you can layer it. When we layer skincare, we always go from thinnest to thickest. So you start with your cleanser, then your toner, then your thinnest serum, and then your moisturizer is last before sunscreen. And then the last ingredient for acne to look for is azelaic acid. So azelaic acid, it's kind of cool. Azelaic acid is a natural acid that's produced by Malassezia, a yeast that grows on the body. And when it's out of balance with all of the other microbiome on your body, it can produce something called tinea versicolor. If you've ever seen that or experienced that, it's fairly common. And it can show as pink areas or white patches on the skin of the trunk and the oily areas of the body. And this Malassezia yeast, it produces azelaic acid, and the azelaic acid bleaches the skin white. And that's why if you've ever experienced tinea versicolor, you will notice that when you get tan, those areas don't get tan. And that's usually the biggest complaint I'll get when somebody comes into the office with tinea versicolor is they notice it in the summer when they're getting tan outside and that area doesn't get tan. So we've used this azelaic acid, this special acid produced by natural yeast, and it works actually very well for acne, and it reduces redness, and it also helps fade and lighten acne marks that happen after acne goes away. So ingredients you look for: salicylic acid, benzoyl peroxide, retinoids, especially your liposomal retinol, niacinamide to reduce inflammation, and azelaic acid. These are the top ingredients that you should look for if you're someone who struggles with acne. And before we move on to the next question, the only thing I really, really want you to know as a takeaway, because we live in a society where there's always going to be a new TikTok video and a new trend of somebody saying something's the best, is you must stick with a plan for 6 to 8 weeks. When I grab my skin, there's pimples formed deep in those layers. It's going to take 6 to 8 weeks for those to purge and surface up. So we need to stick with the same regimen for 6 to 8 weeks before moving on and adding anything else. So be patient and you will get the skin that you deserve. Okay? So that's the first question. Now listen, if you are listening to this and you have other questions, you keep sending them to me. We will get to every question, because if you're wondering something, somebody else is wondering something out there. Okay, so the second question I got, and we're going to stay in this topic of acne, is should I use a moisturizer if I have oily and acne-prone skin? My initial response is yes. There's a caveat there, though, because we don't live in an absolute world, right? There's times that it's going to work for you and time that it's not. But basically, it's a common misconception that oily skin doesn't need moisturizer, when in fact it does, because skipping moisturizing can lead to increased oil production and cause even some dryness in some areas, which can cause clogging of the pores and inflammation. This is why I love the Moon and Skin moisturizer, because it has hyaluronic acid and kojic acid in it. What you want to look for is you want to look for something that's oil-free. You want to look for something that's non-comedogenic. And if you're very oily in the T-zone, just apply moisturizer to the periphery of your face. If you find that your cortisol runs a little high during the day, like mine does, you may not need moisturizer during the day, maybe just the periphery of your face, or skip it. But you always, always, always need to use a moisturizer at night. When we're sleeping at night, our body is in the regenerative and renewal phase. And this is when we really lose a lot of water. There's something called transepidermal water loss, and our skin is evaporating all of that moisture. And it's a great opportunity to add hydration to the skin, so it pays dividends during the day. So you must use a moisturizer at night. But not everyone needs to use it during the day. So I want you to listen to your skin. Do you need it everywhere? Do you need it just on the periphery of your face? Do you just need it on your neck and your chest to help minimize the rate at which you're aging and the appearance of fine lines and wrinkles? So these are all things you ask yourself when you're determining if you need a moisturizer twice a day. But even if you're oily, even if you're acne prone, you do need a moisturizer at night. You just want to choose the right moisturizer that's going to be oil-free and non-comedogenic. So the other thing I want to bring up is that many people will notice that they'll only break out during a certain time of month. So in our podcast episode about skin syncing, I discussed in detail your infradian cycle and working with the infradian rhythm of your body and how your skin's needs will change throughout your monthly menstrual cycle. And there's certain times a month you may need more moisturizer, and there's certain times a month you might need less. So I want you to listen to that episode if you want the small nuances on how to take care of your skin. The other thing is our skin's needs are going to change through the seasons. So in the winter, someone who may have oily or normal skin will be more dry in the winter. And someone who has drier skin is going to be more moist in the summer. So we will be discussing how to rotate your skincare with the seasons. And that's a great opportunity because, as I mentioned before, with acne, giving it about 6 to 8 weeks to take effect, we really want to readdress our skincare every season, every 12 weeks, and adjust it accordingly to get the best skin that we deserve. Let's jump into a question about foods. I find that the questions I get on foods are so triggering. So anything with nutrition is always up for debate, and it's just triggering for people. It's fascinating to me. And all I'm doing is I'm a medium. I am a channel to share scientific information with you. You can choose to receive this information and do with it as you please. Okay. I mean, even with the knowledge I have, I'm not perfect. I ate carrot cake the other day and I paid for it with 2 pimples. So, you have the information, and it will hopefully help guide you into the direction to give you beautiful skin. But nobody is perfect. So if you don't have to be perfect, you just have to do the best you can. So this question leans into foods. So can certain foods trigger breakouts was the question. Can certain foods trigger breakouts? When I was in medical school many, many years ago, we were told that food plays no role. Food plays absolutely no role in your skin health, in whether or not you get acne or anything like that. And that's not true. So it just makes absolutely no sense that you could take medicine in your mouth and it could magically know where to go to make you heal. But the food that we are taking in every day is not going to play a role. It absolutely does. What we drink, what we eat, even who we kiss determines our microbiome and the health of our gut. So be discerning with what you put in your mouth, and it's going to represent itself and show itself on your skin. So what do we know about acne, though? There's things we know, and there's things that you might know affect you, but don't affect everyone. So this is an evolving area of medicine, and it's really hard to prove a lot of things with scientific studies because when you're doing a study, you have to control for every little thing except for that one variable to prove that it is making an effect on the skin. So with acne, though, there are a few things that we do know for sure. High glycemic foods, foods that turn into sugar rapidly in your body are linked to acne. Absolutely. So what does this mean? It's not just sugar. So if you go to Starbucks and you get a Frappuccino, yeah, that's high sugar and it's going to bump up your glucose levels in your body and you're going to be more likely to get acne. It's also processed carbohydrates like instant oatmeal or rice or pasta or breads. These things convert into your body into a glucose molecule, and your body identifies it as sugar, even though it's not sugar when you put it in. When it's broken down by your gut, it turns into sugar in your body and goes into the bloodstream as high sugar. So it's really processed carbohydrates and processed foods that raise your blood glucose levels rapidly. And that leads to increased inflammation and more likely to get acne. So, I mean, I have 2 boys during their teenage years. When it was Halloween and they binged, they'd always break out a couple days later. And this is just part of it. And the evidence was right in front of me. I had patients over the years that were very well controlled. Their acne was well controlled. And they would go home for the holidays and then they would come back and they'd have breakouts. So now we have good science and many studies showing that high glycemic diets, high sugar diets, high processed carbohydrate diets do cause acne. So if you're struggling with acne, start by going lower carb and eating real whole foods. You're never going to go wrong by eating real whole foods that have one ingredient. Okay, second thing is dairy consumption. This is a little less consistent. So I wouldn't say that everyone has a problem with dairy, not in my experience. The studies do show that dairy does cause a lot of inflammation and acne in adults. I find it to be variable, and I think that there's something going on genetically with how we're metabolizing dairy or how the dairy can increase insulin-like growth factor 1, IGF-1, in the bloodstream, or how it increases insulin levels in the bloodstream as well. And it varies depending on person to person. There was a 2018 study in the Journal of the American Medical Association of Dermatology, and it found that participants that drank skim milk, so you think you're being healthier by drinking skim milk, the skim milk had a higher rate of acne. Skim milk tends to cause more acne than those who consumed whole or no milk. And we think that's because the lack of fat in the skim milk changes how the hormones are absorbed, causing higher IGF-1 levels and a greater insulin response with the skim milk consumption. So the fat actually in whole milk will reduce the rate at which the blood sugar spikes. And I'm not saying eat whole milk instead. Really, the only way to know if dairy is a problem for you, if you struggle with acne, is to stop it completely for 6 to 8 weeks and then wait till your skin is clear. And then when you reintroduce it, you'll know if it's a problem for you. That's really the only way to know if it's a problem for you. Also, some people have more of a problem with the casein protein in dairy than the whey protein in dairy. So I do have some patients that they have a lot of acne and they have to avoid dairy in general, yet they have no problem with whey protein. So the only way you're going to know if it's going to be beneficial for you is for you to completely eliminate it, do an elimination diet for 6 to 8 weeks, and then when you're clear, reintroduce it slowly, watch for about 2 weeks and see if it plays a role. The third thing I want to mention about diet with acne is we notice that adults that have fattier and sugary processed foods basically have higher insulin levels, higher IGF, more metabolic syndrome, basically more inflammation overall, and they're going to have more predisposition to acne. Whereas people that have a diet that's rich in whole foods, fruit, vegetables, real foods, fish, that is correlated with less acne. So I want you to focus on anti-inflammatory diet, a whole food diet, and omega-3 fatty acids and antioxidants. Okay, this question is something I'm so passionate about. So when I was a resident, I was the only woman resident. So every woman over the age of 20 that had acne wanted to come to me. They didn't want to see the man doctors. They wanted to come to the female doctor. So I have been seeing adult hormonal acne since the 90s. And I see it get more and more prevalent over time. And I know it's the environment because I asked my mentor, did you used to see this much acne in 20, 30, 40, 50-year-olds? And he said no. And this was 25 years ago. And now we see even more. So this question has to do with hormonal breakouts. So let's talk about what hormonal breakouts are. So the question is, how do I deal with hormonal breakouts? And there's ways to treat it. At the end of the day, though, I want you to ultimately take agency over your own health and prevent it, right? So short term, we treat things. Long term, we prevent things. That's the take I have on all of this. So what is hormonal acne? It's different than regular acne. So if a teenager has acne, they might have blackheads, whiteheads. They might have big red juicy pimples, inflammatory papules and pustules. What I see with hormonal acne, it's typically around the jaw and the chin area, and they're deep, tender red cysts that happen in this sort of mask area on the chin and the jaw. And they're usually pretty tender and they last a long time, like 3 or 4 weeks. And when they go away, they often leave discoloration afterwards that can last many, many months. If you're fair-skinned, it will leave a pink area. And if you're dark skin or medium skin tone, it will leave a dark area, like a brown spot, sort of like what you get after you get a cut. And that post-inflammatory hyperpigmentation can often be more scarring than the acne itself. So the one thing is don't pick these type of pimples because you usually don't get anything out of them, and it causes more scarring if you pick them. So just don't pick them. As far as treatment options, if you're in the office seeing a dermatologist, you can be prescribed a medication called spironolactone that basically helps block the receptors from higher circulating hormone levels in the body. It's not something that you should ever take without a prescription if you can get access to it on the internet nowadays. But it is something that works very effectively, and I use it in the office while I give people lifestyle recommendations. Because when you change your lifestyle, it takes 3, 4, 5 months to really see an effect. But we're playing the long game here. We're playing the long game of beautiful skin for life. So short term, okay to take these medications. Long term, I want you to get off the medications and use lifestyle as your treatment. The other things we can do for hormonal acne, we discussed the retinol at night, and you can use benzoyl peroxide or salicylic acid in the morning. This is really an internal condition, though. It's not so much external. So while the skincare can certainly help, because it's going to help, especially with the retinoids, to lift off the pigmentation and prevent pigmentation from forming after the pimples go away, we need to address the hormonal imbalances inside the body. So there's some evidence actually showing that supplementation, in addition to all the dietary stuff I just answered from the previous question, there are some supplements that can help with this hormonal acne in adult women, particularly around the jaw and the chin that we mentioned. So the first is saw palmetto. So saw palmetto is a prescription, and not a prescription, it's a supplement that men often take for BPH or prostatic hypertrophy, like in a large prostate basically. And it works by blocking 5-alpha reductase, which is an enzyme that converts testosterone into dihydroxytestosterone. And this is a major trigger for adult hormonal acne. And one of the other things that the saw palmetto does is it reduces sebum or oil production. So sebum is basically oil production from the pores. And the saw palmetto can help reduce the sebum and make it especially useful for oily or acne-prone skin, or when somebody has PCOS and they also have like hair growth in areas that they don't want. There was a study back in 2012 in the Journal of Cutaneous Aesthetic Surgery that found that saw palmetto helped reduce sebum or oil production and acne in individuals with oily skin. And there's another study in 2010 in complementary therapies in medicine that suggested that saw palmetto reduced androgenic activity, which can also help treat hormonal acne. And the dosage for saw palmetto is between 160 to 320 milligrams per day in these studies of the standardized extract. The thing is that saw palmetto can cause digestive issues in some individuals, and it's definitely not recommended during pregnancy or breastfeeding. And if androgen activity is not the cause of your hormonal activity, that's not going to be the best treatment for it. So you do want to have an individual evaluation to determine if this is the right supplement for you. Another supplement that I use a lot is called DIM, D-I-M, and it stands for diindole methane. And this works by balancing estrogen metabolism. So this can help to reduce breakouts as well that are caused from hormonal imbalances. And the nice thing is that DIM is found in cruciferous vegetables like cauliflower and broccoli. And I actually love broccoli sprouts for this purpose. I want you to look at medicine as food. So I usually will keep some broccoli sprouts in the refrigerator, and I just take a little chunk and eat them a couple times a day, and it helps with liver detoxification. So that's really, really beneficial. And there was a study back in 2011 showing in the BMC Dermatology that found that DIM helped reduce acne in women with hormonal imbalances. The dosage is around 100 to 200 milligrams per day. I don't like people to be on DIM for long periods of time. I'll often cycle them through for 3 months to kind of rebalance things and then instill good lifestyle measures. And part of the lifestyle measures are reducing exposure to endocrine disrupting chemicals. So there's plastics, there's phthalates, there's all sorts of ingredients or chemicals in our environment that are causing us to have endocrine and hormonal disruption. They mimic estrogen, and we want to eliminate our exposure on that. And I'm going to do a deep dive on that in the future episodes, so stay tuned for that. But DIM may be helpful in this category. There's another supplement which I find that a lot of people can tolerate pretty well, whereas the saw palmetto and the DIM, it's really a case-by-case basis of who uses which supplement. Myo-inositol is one supplement I find I can utilize in most people with benefits. And the way myo-inositol works is it helps balance insulin levels. So we talked about how dairy and sugar can boost your insulin levels and cause inflammation and lead to acne. So the myo-inositol helps to balance this. And then it also helps to reduce insulin resistance, which is a major, major trigger for PCOS and hormonal imbalance. So in people who especially struggle with PCOS, I love myo-inositol. It can lower testosterone, it can improve ovarian function in women with PCOS, and reduce hormonal imbalance and hormonal breakouts, even if you struggle with it certain times of the month. Myo-inositol also helps with oil production and prevent clogged pores. And it's great that they're doing studies behind all of these. So there's a study back in 2017 in the International Journal of Endocrinology that found that myo-inositol significantly reduced testosterone levels and insulin resistance in women with PCOS, and it led to fewer acne breakouts. There's another study in 2016 in gynecological endocrinology that found that myo-inositol improved metabolic and hormonal imbalances, which helped reduce acne in PCOS patients. So what's the dosage? It's around 2,000 to 4,000 milligrams per day divided in 2 doses. And I actually have a powder that I mix with my coffee every morning. So there's ways to take this. You could do capsules, you could do powders, all sorts of things. And the best form, as I mentioned, is myo-inositol. It's often combined with D-chiroinositol in a 40-to-1 ratio for PCOS, but you want to look for that myo-inositol form. It's generally very safe. It can cause a little bit of stomach digestive issues at high doses, so stick with the lower doses. The doses in the studies were 2,000 to 4,000 milligrams a day, divided into twice a day. And just start low and go slow. And the digestive issues typically happen at higher doses. And the myo-inositol, unlike the DIM, tends to work better the longer you use it. So with the DIM, I like it for shorter periods of time of 2 to 3 months. But with the myo-inositol, I like it longer term for acne reduction. It tends to work a little bit better. Okay, so those are the 3 supplements that I look at adding and incorporating into the lifestyle modifications for my patients that have hormonal acne. But what about just supplements for all acne? Okay, there's some studies behind using different types of supplements for all acne. Zinc is going to be the most studied and the most effective. And zinc is pretty cool because it reduces inflammation and bacterial growth, especially of Cutibacterium acnes or C. acnes, which is the one that's linked with acne in the inflammatory papules. Zinc also helps reduce oil production and it aids in wound healing. So after the acne goes away, we want to have as small of a scar as possible. There's a 2014 meta-analysis that found that zinc supplementation significantly reduced acne severity. And there's a fun fact. So I live in Arizona, and Arizona used to be a mining area for copper. So there's a lot of copper in the earth in Arizona. And it also gets into the water supply. So we have high copper levels. So where you have copper and zinc do a little dance together. So the higher your copper, the lower your zinc, the higher your zinc, the lower your copper. So often in Arizona, which I haven't seen in other areas I've lived, I find that zinc is really, really effective in treating acne. Now, when I'm using it, I'm only recommending 30 to 50 milligrams per day, because if you use too much zinc, now you're going to lower somebody's copper levels. And we don't want to interfere with copper absorption and lower somebody's copper levels too much. We want to keep healthy copper and healthy zinc. So we're supplementing, we're not overdoing it. Just like everything we were talking about here, more is not better and more effective. It can be more problematic. So zinc at a dosage of 30 to 50 milligrams a day in the form of zinc gluconate or zinc sulfate may be beneficial for acne. It's only going to work if you're deficient in it. If you have plenty, it's not going to work, right? That's how supplements work. Okay, the second supplement that has been shown to be beneficial for most people with acne is omega-3 fatty acids. I'd say the one negative with omega-3 fatty acids is it can thin the blood. So you want to check with your doctor if you have other medical conditions and make sure it's safe for you. More isn't necessarily more better as well. Isn't better as well. But omega-3 fatty acids can help reduce inflammation, help with your skin bilipid membrane, and help to balance oil production. So even though you're consuming an oil, it's going to help with balancing oil production by promoting more positive, healthy oils and reducing the inflammatory oils in your skin, and support a healthy skin barrier. And there's a study back in 2012 at the Acta Dermatovenerologica, love the European names, journal that showed that omega-3s reduced inflammatory acne after 10 weeks. So everything we're talking about, we're giving it 6 to 8, or in this case, 10 weeks to work. So stick with the plan. And this is at a dosage of 2,000 milligrams per day of combined EPA DHA. Eating actual cold water fish that's low in mercury is always going to be your first choice. Supplements are your second choice. The third supplement that I love for acne-prone skin is vitamin D. So before you consume vitamin D supplementation, you want to have your blood levels checked. And in the US, I like a blood level that's 60 to 80. That's like a real sweet spot. Under 100, over 60 is really where I liked it. But 60 to 80 is where we like the blood levels to be. And most people are deficient in vitamin D. And vitamin D acts as a hormone more than a vitamin in the body. It does so many things. And as far as acne goes, it helps regulate the immune system. So you'll have less inflammation. It's going to reduce inflammation. And it's going to help control and mitigate sebaceous oil gland activity. And there's a study in 2016 that found that vitamin D deficiency is very common in acne patients. And supplementation to get to the point of adequate vitamin D levels will help improve acne. So keep this in mind, because this is just a low-hanging fruit that's attainable for anyone. And the dosage of vitamin D is around 2,000 to 5,000 IU per day. You need to check your blood levels first. I've never seen anyone overdose at 5,000 IU per day in my experience of 20 plus years. Okay, the next supplement that has been shown in multiple studies to help with acne are probiotics, because we know that the gut is related to the skin and the brain. Your gut, brain, and skin are all on one axis. They're all derived from the same cell type when you're an embryo. So it's all interrelated. And we're finding more and more that the health of our skin is related to the health of our gut. So if you're having GI distress and acne, they are related. So we want to improve the health of your gut and the health of your skin, because both will happen simultaneously. So we know a lot about the fact that having a healthy gut microbiome is important. We haven't quite nailed down what we want to see in the gut. We want to see as much diversity as possible. And the more diversity we have in the gut, the healthier our gut's going to be. The less diversity, the less healthy it's going to be. So just throwing probiotics don't necessarily fix the gut problem. There are certain probiotics that have been shown to be helpful for acne. So there was a 2021 review in Dermatology and Therapy that found that probiotics improve acne by reducing inflammation and stabilizing the gut-skin connection. Specific strains of antibiotics are Lactobacillus rhamnosus, Bifidobacterium bifidum, and Lactobacillus acidophilus. But my opinion, honestly, after observing and practicing and reviewing the literature, is to incorporate fermented foods. So you don't want to do this quickly because you'll have a significant amount of GI distress, but I'm kind of in love with fermented foods, especially sauerkraut, kimchi, and my newest favorite, which I'm creating myself, and I'm not a cook at all, is beet kvass. And it's basically fermented beet juice, which to some of you that might sound gross, but sauerkraut is kind of neat, and kimchi, because you can add it. If you make some beef or you make some chicken, you can add it with some vegetables and you just put it on the side. And these fermented foods impart really beautiful, healthy, diverse microbiome to your gut. And short term, your body may have some issues acclimating, but start low and go slow. And over a few months, you're going to just notice your skin glowing and you're going to feel better. And maybe some of the joint stiffness or joint pain that you had is going to go away. And you're going to be able to tolerate foods you might not have been able to tolerate in the past. So I really want you to look at your gut as like the brain of your body, basically. It's really amazing. The other thing is fiber is very important, and prebiotics. So prebiotic fiber is really important because you can be taking in probiotics or the actual like organisms. And if you don't have the prebiotic fiber, which is the food to feed them, they're not going to survive. They're just going to die right away, and you wasted your money on the probiotics. So you want to focus on prebiotics and fiber to feed your healthy gut. So you support it. It's like Miracle Grow for the plants of your body. We want to feed the good bacteria in our body. Okay, the next one is N-acetylcysteine, or NAC. So N-acetylcysteine, NAC, it is a super powerful antioxidant, and it reduces oxidative stress and inflammation. This is known as mucormyst in the hospital. And when I was an intern working in the ER, we would have patients that came in that maybe took too many Tylenol, and they were going to have liver failure. And we would give them N-acetylcysteine. So N-acetylcysteine is amazing at supporting liver detoxification. And liver detoxification is essential to work well because it helps clear the toxins that also affect their skin. So all we're doing here with all of these things, whether it's food or supplements or anything else, is we are supporting the body to do what it wants to do, which is to detoxify, renew, and regenerate itself. The other thing about N-acetylcysteine is that, or NAC, is that it helps regulate glutathione. And glutathione is the most powerful antioxidant in the body. And it's also essential for clear skin, for even skin tone, and for acne-free skin. There's a study in 2012 in the clinical and experimental dermatology that showed that NAC, N-acetylcysteine supplementation, improved acne. So once again, we have science behind these. So what's the dosage in the study? It's 600 to 1,200 milligrams per day. You could take it once a day, twice a day. We're just supporting the liver to do what it needs to do. And the last thing I want to talk about, which I've talked about before, is spearmint tea. So spearmint tea is anti-androgenic, which means it lowers the testosterone hormones that tend to cause hormonal acne in women. So by reducing the testosterone levels that can trigger the hormonal acne, and being anti-inflammatory and helping oil production, spearmint tea is a natural winner for reducing acne. There's a study in 2015 in Phytotherapy Research Journal that found that drinking spearmint tea twice a day for 30 days lowered androgen levels and thus reducing acne. So how much do you drink? First of all, I want you to find organic spearmint tea, and I want you to avoid tea bags that contain plastic in it because plastic is an endocrine disruptor. So loose leaf tea is going to be your best bet, 1 to 2 cups a day. So the studies show 2 cups a day. Even 1 cup a day is going to be beneficial. So these are your supplements that are going to help with acne. We mentioned saw palmetto, we mentioned DIM, we mentioned myo-inositol for hormonal acne. For all acne, we mentioned zinc, omega-3 fatty acids, vitamin D, probiotics, and fermented foods, and acetylcysteine and spearmint tea. Now, what do you want to avoid? Because we want to avoid things that are causing acne before we start adding things in. You want to avoid biotin or B7. Vitamin B7 is biotin. Biotin can worsen your acne by increasing keratin production and clogging pores. So while there's a lot of hair supplements that are using high doses of biotin to supposedly increase hair growth, which we need to discuss on a future episode, biotin can worsen acne. So if you're taking biotin and you have acne, I'd stop it. The second is iodine. So iodine, especially in high doses, or if you have a ton of seaweed, which I do like seaweed, and iodized salt, this excess iodine can trigger acne breakouts. So you want to stop that as well. And before you just take all of these supplements, I want you to consult with a healthcare provider before starting anything because responses can vary. Everyone has different causes and there's different potential side effects and interactions with different medications. So that's all I want to cover today in this deep dive for acne, answering your questions. Amazing questions. I love it. Thank you for giving me the opportunity for this platform to share information with you, to empower you to have clear skin. At the end of the day, all of these are science-based suggestions, and you need to tune in and listen to your own skin. Till next time.
Thank you for joining us on Listen to Your Skin by Moon and Skin. It's an honor to be part of your skincare journey. And if you love this episode, make sure to subscribe, leave us a glowing review, and share it with someone who's passionate about their skincare journey. And please connect with us on social to ask your questions, which will drive future educational episodes.